Hello, good afternoon, and thank you for joining us for this webinar on COVID-19 from Sydney, Australia. Good day, Australia, kia ora, New Zealand. I'm Jean-Christophe Nougaret. I'm the head of communications for Médecins Sans Frontières in Australia and New Zealand, MSF standing for Doctors Without Borders. We are going to discuss today about the COVID-19 pandemic, a pandemic that is affecting the whole countries in the world. There has been already millions of patients who have suffered this pandemic, and thousands of people, unfortunately, have died since January 2020. So far, Australia and New Zealand have been a bit preserved by this pandemic and managed to control anyway its impact, to the fact that we are seeing today flattening the curve in both Australia and New Zealand. But lots of questions remain open, mainly for the impact on the low-income countries where MSF is working, and we are particularly worried for the impact on the most vulnerable group of population. To talk about this topic today, I have the pleasure to welcome Dr. Sachsveen Singh. Hi, Sachsveen. And I could say good morning because you're joining us from Perth, Western Australia. Sachsveen, you're a medical doctor, you are a tropical disease and infectious disease advisor with Médecins Sans Frontières, and you are particularly following the COVID-19 epidemic impact on our programs around the world. You have experience working in DRC, in other countries in Africa on other types of outbreaks like measles or Ebola. I'm also joined by Jennifer Tierney. Good afternoon, Jennifer.
Good afternoon.
You are the Executive Director of MSF Australia and MSF New Zealand, and you have yourself been working in other countries like Lebanon and South Sudan for MSF. So I will start with a first question for you, Dr. Singh. In a few words, can you remind us what is this disease and how does it affect people?
Sure. So I know people have been a little bit overloaded with all the information over the last several weeks, but just as a summary, coronavirus or COVID-19 is a new virus that's not been seen before in humans, and we think that there could have been an animal origin, but that's still being investigated. Coronaviruses are quite common, and they have been documented in many different animal species as well as humans. There's some common human coronaviruses that span from ones that tend to cause something like the common cold, but then there are also other related coronaviruses that we know of, called SARS or MERS-CoV, that can cause a bit more severe disease in humans. And coronavirus or COVID that we're dealing with now is illness that's transmitted through respiratory droplets or through contact with those droplets. So if someone has a cough or a sneeze, these little droplets can be in the air and then drop to a surface, and if we touch them, then we can then infect ourselves. So that's the basis of the transmission of the disease, and as we've seen, it can cause respiratory symptoms that can span anywhere from some minor upper respiratory cough and sneeze, but then a small proportion of the people, it tends to be about 1 in 5, that will become quite unwell with the illness.
Okay, and where are we now in terms of the spread of this pandemic? Because it mainly affected Asia, Europe and North America, but I think now the disease is spreading.
Yeah, so at the beginning of the epidemic, as most people will know, that the first area of transmission was in China, but respiratory illnesses can travel quite quickly because they're just through the usual routes of transmission, people in close contact, so it can spread quite rapidly through urban areas. And due to globalization and a lot of international travel, we saw introduction into some other countries, and now we're in a space where almost all countries are touched in some way by this pandemic. And the global hotspots now are in the US and in Western in Europe, but we're seeing increasing cases, even in places, quite remote places where MSF are present, in places like Papua New Guinea have cases, and then also to quite big countries in Africa and also in South America.
Thank you very much, Sachsveen. Jennifer, maybe you could remind us how MSF is responding to this pandemic. I think it has affected almost 50 of the countries where we are working already.
Yes, that's true. First, I want to just say thank you to everyone who's attending today. I know that we are a bit on COVID overload, and we're just really pleased that you're taking the time to listen to what's going on in a lot of the places outside of Australia. It is true that we are working in 50 countries on a specific COVID response, but as our operation directors have said, no program, every program has to do with COVID at this time. I mean, as we know, every single medical practitioner in the world really is affected by this disease. So the timeline has been, since the awareness of the disease began in early January, December, we've obviously started monitoring the spread of the disease. We did some early projects early on in Hong Kong, talking to what we might discuss as a marginalized population, people who are homeless or didn't have access to information about how to protect themselves from the disease or how to access information about where to receive treatment. We then started to see the spread of the disease, and as we followed that, we started to ramp up our projects and look at training medical staff in our projects on how to protect themselves, doing community outreach on all of the things that we just heard about in regard to infection prevention and control, social distancing, hand washing, not sneezing on one another, social isolation as much as or physical isolation as much as we could at the time. From there, we've really looked at expanding our projects even further and converting a lot of the projects that we're doing to be COVID specific. So the spread of the disease and the knowledge that 1 in 5 are going to have that really serious impact means that we do need to have medical facilities available to those who have respiratory illness and struggle. In the places where we work, that's very rare. You're not going to find wards that are available to treat people who have serious upper respiratory problems or organ failure that we're hearing about. And so we're doing the best that we can, taking trauma facilities that we're using and turning them into COVID-19, for instance, in Haiti and Jordan. And that's where we are right now.
Thank you very much, Jennifer, for this presentation. And just as a reminder for the people who are joining us during this webinar, you can share your questions with us by sending the comments on the Facebook page. I may have a follow-up question for you, Sachsveen. You have been working as I reminded at the introduction, on measles, on Ebola outbreaks. So what did you learn from working in these environments that you are using or MSF is using to fight this COVID-19 pandemic?
That's a really good question, Jean-Christophe. So I think through my experience in working in various settings with MSF on outbreak response, there are some essential, what we call essentially pillars of an outbreak response that must be addressed, and that can encompass anything from the usual case management and medical care of patients, which as a medical organisation we do a lot of, but it also involves other things like laboratory testing and then also community engagement. So that involves working very closely with communities, and any epidemic has the capacity to really shake a community to its core, and can have quite complex effects on communities in terms of their social well-being, economic well-being, and then of course the health of communities, which can be quite difficult. Working with Médecins Sans Frontières on the field, we do have a big focus on communities and people's health and livelihoods, and also a lot of experience in responding to quite complicated outbreaks, and we're lucky to not just be a medical organisation. We also rely a lot on the expertise of our many colleagues who work in things like administration, human resources, and logistics, and all of these elements come together to create a big team that is really important for a coordinated response. And then also the risk communications to communities, making sure that they're well informed, that they understand the illness, a big focus on health promotion, coming back to the simple things like Jennifer mentioned, infection prevention and control is vital, and we've been doing that since the beginning of this epidemic, and we will continue to do that in the communities.
Thank you very much, Sachsveen. You were mentioning about communities, and we already have some questions coming online, but I can direct, if it's okay for you, to Jennifer. First question is, so Jennifer, you had experience working in Lebanon and working in South Sudan with people living in difficult conditions. Leanna has a question for us on how is COVID-19 affecting refugees and refugees' environment, for example?
So it's an excellent question. It's one of the primary groups of people that we're focusing on. And so, you know, when we are approaching COVID and when MSF is approaching any medical project, we're looking at the people who really sort of fall through the cracks of the traditional medical and healthcare systems. Refugees are an excellent example of that. So if you take the directions that we're following here in Australia and New Zealand, which is to keep distance from one another, to wear masks if we're feeling unwell, or if we'd like to protect ourselves, to wash our hands frequently with soap and water, all of that. And then you take that same advice and you put it into a refugee camp setting, it becomes incredibly difficult to execute. While it seems simple, when you've got 10 people living in a tent, you know, a tarpaulin tent, which really doesn't have solid walls, there's no such thing as infection control. When you've got people who have incredibly limited access to clean water and soap, again, you are removing the possibility for infection control. And then you've got the issue where, you know, refugees who don't typically have access to a healthcare system, who are living on the margins, if they get exceedingly sick or a family member gets exceedingly sick, there's just no resource for them available. So we are working to provide those things, to call for space as much as possible. I mean, if you go on our website and look at some of the requests that we've made of the European Union and the Greek government on providing appropriate facilities for refugees living in Greece right now, we are trying to create more cordoned off spaces for people who do become sick. And of course, as always, we're providing water and sanitation wherever we can.
Thanks for this valuable feedback. Thank you, Jennifer. Maybe the next question coming from Natasha, I will direct it to you, Sachsveen. Natasha is maybe a medical personnel because she's asking what IPC measures are MSF following. So maybe you can remind what is IPC?
Yeah, so for those that are joining us that don't know much about what IPC is, so there's a lot of abbreviations in the medical world, so that's totally normal. It stands for infection prevention and control, and this spans everything from personal protective equipment for healthcare staff, but then also hospital disinfection, routine cleaning, and then also the real bare basics. We always talk about these sort of essential 5 moments of hand hygiene. You know, so IPC also involves hand washing points, and so in terms of what MSF is doing in terms of IPC, so as Jen mentioned, we since the beginning of the outbreak, we've been ensuring that all of our health facilities where we already had IPC measures in place, we just were reinforcing those, continuing ongoing training for health staff and also for communities on how to ensure that they're following these processes and procedures that are really going to help prevent or at least diminish diminish the transmission of the illness. Then we also have been working to ensure that all of our fields have the appropriate personal protective equipment. And many of our listeners probably have heard in the media about the global shortage of personal protective equipment. This has been incredibly challenging for our field staff. We are looking at a massive shortage of really essential items like masks. We actually need about 4 million masks a month in order to sustain our projects. And at this point, we probably only have enough for the next coming weeks. So it's quite drastic, and we're working really hard to make sure that we can protect our health staff. Without our health staff, we don't have a response, and we can't protect the communities and the vulnerable people that we need to look after.
Thank you very much, Sachsveen. And it's a good segue maybe to come back to you, Jennifer, with a question on, this looks like a massive need and all at a sudden, all together throughout the world. How is MSF Australia and New Zealand, and how can we support such massive needs throughout the world?
So it's been an incredible time to be with MSF. I mean, I just came in a few months ago as executive director, and one of the things that I've seen as a movement is that we've been really nimble. We've sort of thrown out the rules of operations, and there have been significant requests coming from Europe and the more COVID impacted countries to say, how can you, in Australia, New Zealand, et cetera, help? One of the first things that we did was we've got people working on a project here for North Korea. North Korea closed its borders, so they were unable to go. We switched their focus to looking to support the call for personal protective equipment. They used the vendors that they've talked to support North Korea, and secured 1 million masks for our staff, which was a great thing. So any donor who's given to MSF over the past months can certainly be proud of that. The other thing that we've done is launched a Facebook fundraiser. It's not something we've ever done before. We always sort of fundraise in our home societies, but this is a global fundraiser for the COVID response. So of course people can give. I also want to say that there are a lot of Australianders, and I don't have the exact number right now, but it's approximately 40, and New Zealanders working in the field. So just incredible support to the field from these countries. And those numbers are actually a little bit smaller than typical, because we brought people out of the field quite quickly who were 60 plus years old or who had pre-existing conditions that would make them more vulnerable to the more serious effects of COVID-19. So there are a number of ways that we can help. We are looking for creative ways to access PPE. So if anyone has any ideas, we are really open to that right now, really and truly, both from a purchase standpoint and a donated standpoint. We do, of course, have to follow the medical standards on PPE when we do that. And we are talking to various flight transport agencies about how they can move both people and goods in and out of New Zealand and Australia, as they're very difficult to move from the more heavily COVID affected regions like France, Spain, and Italy.
Thanks. And just on a practical side, how have you been managing reorganizing the office, basically all the staff of MSF Australia?
Yeah, that on top of everything else, right? So I will say I am so deeply proud of the office. I mean, we kind of saw this coming and thought we have to get ourselves in order. We think we are going to have to move to remote working. And so we had about a week or two to put things in place before, and we did it before the government made the recommendation, but because we're a medical organization that's used to outbreaks, we thought, there's something going on here. So we are completely remotely working. We have been for quite some time. We've shut down all travel. The staff aren't moving. We're no longer doing community fundraisers or fundraising on the street at all to reduce contact. Our staff still are coming and going, but they are, of course, abiding by all the rules and regulations put into place by the Department of Health, quarantining when they come back and et cetera. So it's been just as with everyone, it's been a big challenge. And I am homeschooling a 6-year-old in their room right now while we do all of this. So we're all living the dream.
I have other questions coming online. One is for you, Sachsveen, on there are statistics, there are figures at the moment, but there are also all the people going through the cracks. Do we have any idea what is already the impact in countries where MSF is working, in Africa, the Middle East or Asia, and how reliable are the statistics?
So that's a really excellent question, and quite difficult to answer at this point. So what we do know is that the official figures are really only based on positive test results. Some of you might be aware that actually there's also a global shortage of testing kits and reagents, and although organisations such as the World Health Organization have been trying to assist particularly low middle income countries have access to such tests, it needs to be spread amongst all the countries. So there are some severe limitations in the amount of tests that can be done. So for example, we have a project in Burkina Faso, and we do know that there are positive patients there. MSF has set up a unit. We've been working with the Ministry of Health to try and help support them and set up a COVID unit for some response. But at the moment, we've got 10 patients in that unit. A couple of them are severe, but we just don't really have a clear vision yet on what's actually happening in the communities. Some other countries are more affected, but it is quite difficult to get a really accurate picture. And so I think one of the big things that with Médecins Sans Frontières, I mentioned we're a big global team with lots of different skills. There's a group of epidemiologists that we work with who are currently working on some interesting modelling, but in order for them to really be able to gauge how quickly this is going to spread across countries, they need really clear and concise information from our COVID unit. So a little bit of data on how long people had symptoms for, how many people maybe they had contact with, how many people in their families might be unwell, and just to get an idea about the transmission and how quickly it can move through a population. It is quite different because we don't yet know how the illness is going to be, how it's going to act really in populations in the countries where we have a lot of experience working. We work in places where there is a lot of malnutrition. Patients might be otherwise immune suppressed from other chronic diseases or acute illnesses such as malaria and other tropical infected diseases. So we just don't know how the virus is going to act in these populations. So we have quite a lot of concerns, but it was quite difficult to gauge at this point in time.
Thank you. So much more needs expecting us probably than we can already assess. And I have questions online that I may direct to you, Jennifer. One is on the capacity for medical staff to mobilize. Mauricia, for example, is asking, is it possible for medical doctors working in hospitals as registers or advanced training in medicine to undertake a mission that may be shorter than 6 to 9 months as their first mission with the COVID-19 response?
So we are still recruiting staff. We're going through the standard recruiting process, which will ask you questions like, have you ever worked in a remote community in a low resource setting? Do you have experience in the areas that we need? For instance, sometimes it's surgical experience, sometimes it's infectious disease. This probably is an infectious disease moment. So you can certainly go on the website and find that out. We haven't gone into a mode yet where we're sort of shortening and hastening that recruitment process, so it remains the same. Part of the reason why is it's as much demand as there is, it's very difficult to move people in and out of the country right now. And so, for instance, we have a couple of people who we have been trying to get out of the country on the one flight to Doha a few times over the past weeks. That flight remains, but the flight from the UN to transport to their destination country has been canceled a number of times. So while the need in the field is huge, the actual logistic complication of getting people there is limiting our ability to fill those gaps. And so we don't need a massive upsurge in numbers of available staff at this time. And the other issue is, at one point we thought, if we are overwhelmed in the same way the US or other countries would be, might have been that Australian medical staff would not have been available to us. We're not seeing that, as you know, and so we probably have some more flexibility with using Australian and New Zealand staff.
Thank you. And the follow-up question, so there was the question on how people can support by going to the field with MSF, and the follow-up question I have is, how can we financially support such a big commitment from MSF?
Yes, so we did launch this COVID-19 fund. It was initially launched as a $100 million fund that was launched around the world. That shows you a bit of the scale. My personal estimation, which I've shared internationally, I'm not afraid to share here, is that that's not going to...
Your voice is a bit dropping, Jennifer, sorry.
What we need. So, sorry, can you hear me? I think we might. Yes?
Yes.
So 4 million masks a month is a huge expense. The fact that we have limited capacity for commercial flights means that we're having to charter private flights. It's an immense expense. You know, getting the staff on the ground to be able to do community messaging and hiring up to make sure people know what's coming is a huge expense. So all of those things are going to be covered by that COVID-19 fund. And I think actually you can find the fundraiser on Facebook. It's a Facebook fundraiser, and we'll put the information at the end of this so people can give directly if they're so motivated. The other thing to say is that I know it's a very difficult financial time right now for everyone. There's a lot of question marks out there. You know, we're looking for small contributions of any size. And for me, it's a way to feel like, and I donated this morning, a way to feel like you can actually do something where our hands are a bit tied here at home.
Thank you, Jennifer. I have a question for you, Sachsveen, from probably a medical person as well, who is asking me, in these countries where the health system may not be as strong as in Australia or New Zealand, how is the health system coping? How can we support the health system to cope and to protect the health staff? Because as we've seen with Ebola in 2014, the health staff has been the first decimated, and then it was so hard to take care of the patients. What's your take on that?
Exactly. So basically, one of the really important things in this response, and MSF also does have a lot of experience with that, is working very closely with health staff in the facilities that we already work in. Often that's done in conjunction with a Ministry of Health facility, and so it might be some MSF staff and some Ministry of Health staff. So it's ensuring that all of the staff have access to the right information, the right training, and as Jen mentioned before, trying to protect staff that might be more vulnerable. We all know that people in older age groups, not even that old, over the age of 60, are in a very high risk group. So we have been trying to coordinate teams on the ground to make sure that these vulnerable workers can be potentially repurposed into another role where they're not in contact with patients, or to remove them from risky activities. As Jen mentioned, also that the PPE or personal protective equipment is a really important part of helping protect healthcare workers, and then strengthening health systems. It's a really big thing, and MSF we try always to improve the level of care in facilities that we work in, and sometimes that does involve very intensive support to Ministry of Health facilities. We also have an amazing team of what we call logisticians and construction experts who can go in and assess health structures. We can build either temporary structures, using tents or we can build, brick structures to build isolation units. So helping with the logistics and planning of a healthcare facility to organise the flow of patients through a health facility is also a really important part of dividing potentially infectious patients from other patients, because we have to also bear in mind that COVID, it is taking up a lot of effort, but we can't forget the other big killers. I mean, we're coming up to malaria peak season soon. Children are still suffering from malaria. Women still need to have babies in a safe and clean environment. What we might end up seeing is people avoiding health facilities because they're afraid, or they might not be able to travel because of government lockdowns, those sorts of things. So we're really trying to work hard to make sure the planning is in place, that our facilities are healthy and safe. We protect healthcare workers, that patients can access essential care, even vaccinations for children. What we've seen in other outbreaks, I think our listener had mentioned Ebola, but other infectious disease outbreaks can impact on people's access to preventive care. And we saw in Ebola, for example, that some months or a year after that, we had a big surge in measles in the West African epidemic, because people couldn't access these routine things that are life-saving.
Thanks, Sachsveen. And you are mentioning vaccination. I have a question here from Diraj, who is asking about vaccination and about treatment. And maybe Jennifer, you can give us what's MSF perspective on that, on vaccination and treatment, and mainly their affordability, availability, I guess.
Yeah. I think most people who are listening know the story of MSF's work directly in the field very well. One thing that you might not know is that we have something called the Access Campaign and the Drugs for Neglected Diseases Initiative. Both of those initiatives are designed to get treatment, tests, etc., to people who might not have access to them in a developed nation setting. So right now, what we are doing from an access campaign point of view is we are calling for treatment, vaccination, and tests to be affordable and accessible for everyone. What does that mean? That means that any nonprofit institution, any university, any government, any corporation, any pharmaceutical company involved in the development of any of the tools necessary to test, treat, or vaccinate against COVID-19 should ensure that those things are free and accessible as possible. So, we're calling on governments, for instance, to make it easy to get around intellectual property laws and things that typically govern the development of medicines.
Thanks, Jennifer. I will just answer one of the questions that came on the line, and from Meru, who is asking if responders are covered by exemption. So yes, to a certain extent, we can apply for humanitarian exemption to send our staff to the field, coping with the fact that when there are flights and when there are possibilities to travel. Maybe I will direct the next question to you, Sachsveen. The question comes from Mahbub, and sorry if I don't pronounce the name rightly. Is MSF also working in Rohingya refugee camp in Cox's Bazar, Bangladesh, where more than 1 million Rohingya refugees are living there, and in isolation, quarantine is impossible? What's your perspective on we've already mentioned a bit about it, but this specific environment with COVID-19?
Yeah, thanks so much for touching on that, Mahbub. I think it's a really great question. With MSF are certainly present in Cox's Bazar. We have been there for some years now, helping. For those that might not be familiar, there is a huge population of Rohingya refugees from Myanmar who are living in extremely precarious conditions in just south of Dhaka in Bangladesh. As you can imagine, the patients people that are living in such conditions have
as Jen already mentioned, pretty poor access to water, sanitation, nutrition, and the MSF have been present in the camp for some years, providing primary health care. So that can be anything from treating routine illnesses, providing vaccinations to children, essential care for pregnant women, health promotion activities in the camp. We also responded to a quite huge, unprecedented diphtheria outbreak in the last year and a half. And then now what's been happening with COVID, we have multiple groups working with MSF in our structures. We've been working really hard. Our teams are actually on the ground at the moment, putting in place oxygen therapy, really ramping up that, because one of the big things with COVID is that we know that out of the 20% of patients that are affected by COVID are going to need to be admitted for oxygen therapy, and oxygen can be obviously quite difficult to access in a place like a refugee camp. So we've been doing some innovative things where we're putting in an oxygen plant where we can actually generate our own oxygen that will provide to some of our health points, our health facilities through the camp, and then also putting in bottled oxygen and doing a lot of training and support for our healthcare workers there. Also having to adapt some of our activities a little bit in order to avoid crowding in healthcare centres and to make sure that patients can access the care that they need. So yes, we are present there.
Thanks, Sachin. I have a very sweet and nice question from the panel. Angie is asking us to the panel where we are from. So I may start by saying, je suis français, I'm French, obviously, sorry, I can't hide my accent. I'm Jean-Christophe Nougaret. And maybe I send the ball to you, Jennifer.
Yeah, I'm from the US. I grew up outside of New York, and I spent the last 12 years in New York before moving to Australia about 3 years ago. And I will say about that it's probably the hardest part for me about all of this is being away from family right now. My dad and my brother are both funeral directors. They've got 250 COVID cases in their town, never mind their region, and they've buried at least 7 COVID positive cases. So the fact that I can't access them is it's pretty hard right now. Not to bring a downer on that, but I think that this disease has really shown us the limits of this international connectivity. So yeah, thank you for asking.
Thanks, Sachin. You're from Perth, but good luck.
Yeah. I was born in a small place in Australia called Newman. So if any of our listeners are from there, but grew up in Perth, and my heritage is Croatian Indian, but a lot of my family is in Malaysia, Singapore, Croatia, and I moved to Paris a while ago, but back in Australia for a little while, working remotely. And yeah, so I think we're a bit of an international team, and that kind of sums up MSF really.
Yeah. Exactly.
Yeah, it does.
We are without borders.
That's right.
Jennifer, I have a question, a kind of philosophical question for you on your vision of the world from Nina. In your opinion, how might this virus change the society, the world on a larger scale? How might cultural memory be formed around contagion infection? It's really philosophical, and it's something we've already kind of started reflecting on as MSF.
Yeah, I mean, I think, I've been saying this one thing over and over again that I think the media team will start to get tired of, but every single person counts in this. I don't want to contrast that with other moments, because for MSF, every person always counts. That's why we exist. But I think here, the fact that, oftentimes we see the biggest emotional response from people with MSF crises when there's a natural disaster, when something is really sudden onset, when someone can kind of put themselves into the shoes of the person who's suffering. In a war or in something like that, it's a little bit different. because I don't think we can relate as much perhaps in New York or Australia to that. In this instance, we are relating so closely because our family members in our community are going through and we'll see the rest of the world going through the fear, the isolation, the same exact struggles. So to me, I think that there is, we talk about humanitarianism as this one-to-one connection. I think that's probably never been stronger. I would wish it were like that all the time, but perhaps this is just a wonderful illustration of that. And then I will say that's maybe from the business point of view. I mean, look, I am focusing on the positive as well of slowing down we're not really slowing down, let's be honest, but I get to have lunch outside with my 3-year-old and my 6-year-old. I get to wake up and stay with them and not run out the door. And, I think the idea of having to always, the FOMO thing, the fear of missing out, I think that might be a thing of the past when this is all over. I think that, to me anyway, that's my hope.
Thanks, Jennifer. Sachsveen, I have a question from Karen. You've been mentioning about the impact on other sectors of the societies, general impact in the countries where we work on, especially at this period of the year where we are shifting between the dry season, the rainy season, there's the seizure, there's the difficulty around food. So Karen is asking, how is it impacting the already existing shortage of food and already weakened population of children suffering either from malnutrition or malaria?
Yeah, another really good question. So as Jen mentioned before, even in country, particularly in the countries that we work, there's a lot of difficulties with transport. So, for example, in taking somewhere like South Sudan or remote areas in the Democratic Republic of Congo, some of these communities already are very disadvantaged because the road system can be quite poor. In some way, that can almost protect them because they might not be as prone to being exposed to COVID in a way, but that makes them a lot more marginalised in terms of already it was quite difficult for some of these places to get access to care, medicines, and food, and then now with the lockdown in many countries on movements and transport and the importation of items, will likely have quite an impact. In terms of other places that we work in, you mentioned that coming into the rainy season as well, it can be very difficult to land planes in some of these areas. So a lot of humanitarian aid that used to have visit on a regular basis might have significant limitations during the rainy season, and that needs to be planned for. And how that's going to affect children in particular. We did mention malaria before. We've already mentioned the vaccinations, and yeah, so this is something that certainly keeping me up a little bit at night, all the other flow-on effects, not necessarily related exactly to the virus COVID, but all the other things that the other non-COVID illnesses that might be affected.
Yeah.
Thank you very much, Sachsveen. And we're going to come to the end of this webinar. I will maybe share the last question for you, Jennifer. So I have people coming on the chat and asking how they can support and related to that. So Sachsveen mentioned what's keeping her awake at night. What's keeping you awake at night?
Frankly, I think keeping health workers safe is what's keeping me awake at night. I mean, that's one of the really big issues. And there are two elements of that. One, being able to get Australians and New Zealanders out of country projects if they get ill. So we have in place systems for that, but with border closures and everything, the field HR team is constantly working incredibly hard to make sure that stays open. So that's probably our number one priority on duty of care. It's working so far, which is great. The second thing is just, the PPE. I mean, Sachsveen mentioned earlier, we have weeks left. I mean, this is like really serious situation, and it is absolutely plaguing this organization. It is our first priority across the world. So yeah, I think that's a huge priority. We're trying to get creative. We're putting, requests to government, putting requests to private companies, looking at sort of two-tiered ways of doing things, looking at mass appropriation, I guess, of PPE in the millions, and then looking at smaller organizations that they can develop them on a smaller basis. And so just trying to get very creative and yet keep up the necessary medical rigor that we need in the protective equipment, and not just, we can't just do at-home masks for our doctors. It just doesn't work that way. So, yeah.
Thank you very much. You want to remind maybe about the people asking how to support? They can support us through their donations.
Yeah, so you can go right into our webpage, www.msf.org.au, and you'll find the COVID response right up front on the homepage, and a donate button if you care to contribute that way, which we would love for you to do, of course. And thank you. And then we've got this global Facebook fundraiser as well. And so you can do that, which I thought that was going to be listed, I think, perhaps, but that you can do through the platform, or hop off of this onto your Facebook page and find it.
It's coming.
It's coming. It's coming. Great.
It remains for me to thank you. Thank you so much, Jennifer. Thank you very much, Sachsveen. Thank you to everyone who's been with us online. Thousand thanks to all the MSF staff, teams who are working very hard.
And their families, of course.
And their families who are supporting. And we, as we are all working remotely, we are, lots of us supported, and their families in the field. Thousands of staff from MSF working in very difficult environment at the moment. I wish you all good health, keep physical distancing, try not to lose social connections. The internet is good for that, through phones, digital application. You can remain informed, as Jennifer mentioned, through the MSF Australia and MSF New Zealand website. You just go on your search engine and you msf.org.au or msf.org.nz, and you will land directly to our COVID-19 information page. You can follow us on Facebook. You can find us on Twitter. Thanks for your donation again. I'm Jean-Christophe Nougaret. I'm signing off from Sydney, Australia. Stay home, stay safe, take good care of you and your loved ones. Thank you very much again, Sachsveen and Jennifer, for joining us. And bye to all of us.
Thank you, everyone.